The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
Very important, guys, to start slow, go steady. No, it's not a fast race. We're all in this together.
There's a lot of anxiety, depression, and PTSD going on. So just need to make sure that our message as a provider is heard by our minority patients. Making sure that we are here for you. Hi everyone! Welcome to another episode of Mindful Moments. Thank you so much for joining me. We're now on season 2, and I'm so excited to continue bringing you conversations that inspires us to pause, reflect, and look at life, health, and well-being from a different perspective. Today, we are talking about something many of us struggle with, finding our voice and having a courage to use it, even when we don't feel ready. Our guest today is someone who knows this journey from both sides of healthcare. She started as a nurse caring for critically ill patients in the ICU and stroke care. Today, she's a stroke-certified registered nurse. She's an author, podcaster, speaker, and healthcare media consultant. She is helping healthcare professionals and innovators share their stories and connect with the people they're trying to serve. And her book says it all. Speak up. Start now. But what does it really mean to speak up when you're dealing with self-doubt, imposter syndrome, burnout, or simply the feeling that maybe you're not ready yet? And how can finding your voice become part of taking care of your own mental well-being? Today, we're going to talk about nursing, burnout, mental health, storytelling, healthcare innovation, and the power of simply being heard. Please welcome in the house, Rosa Hart, to Mindful Moments with Pedro Morante. Thank you, Rosa. Thank you for being here and sharing this platform with me today.
Well, thank you so much for inviting me, Pedro. I'm so excited to talk to you again. It was so great to meet you in person and now to see you virtually.
And the feeling is mutual. So we met at Vive in Los Angeles, and now we're doing this podcast. So thank you so much for allowing me to share this platform with you. You are a stroke-certified registered nurse, author, podcaster, speaker, healthcare media consultant. You have so much accomplishment. And for those who are meeting you for the first time, who is Rosa Hart and what brought you to nursing?
Oh, well, that's a good question. So I didn't always think I would be a nurse. I wanted to be a ballerina for 5 minutes and then set my sights on being an opera singer. So my first bachelor's degree is actually in singing classical music. And turns out I took a class my senior year of college, or the summer before my senior year. I was pregnant with my son, and I wanted to understand my body and my baby's body better. So I took A&P as an elective, and I was getting better grades than the nursing students were. And I was like, maybe I should be a nurse. And then also my grandfather had a heart attack that summer as well. And I went to the ER, and I was like the only family member who could get there in time to be with like my grandmother while she was waiting while they did the PCI and took the clot out of his heart and opened it back up. And so I got to go with her to see the explanation and the images from the interventional cardiologist, who showed how those blood vessels were blocked and how he had opened it up and you could see the blood flow now and there are the stents. And I was like, you can do that? Like, I had no idea, right? And I was like, this anatomy thing is really cool. And so that's kind of what sparked my interest. So I used the rest of my electives to take a nursing prerequisites. And after I got my first bachelor's, then I got on the nursing track. So it was kind of a pivot.
That's a beautiful story. It's very inspiring. And a lot of our followers here can really relate to your story, that can start a simple family event, turn into passion, and now you're creating an impact. And then you also spent years working in ICU and stroke care. What did nursing teach you about people and about yourself?
I definitely went into nursing with a lot of idealism, and I've always been a pretty empathetic and imaginative person, which helps you be empathetic, right? Because you can imagine how somebody else is feeling. But seeing people, like every work day was seeing people on literally the worst days of their lives. So that was really heavy. It definitely taught me to value alleviating suffering. Like, there's so much suffering in the world. Anything we can do to just alleviate some of it is worth doing, because there's so much we can't do. It really got to weighing on me. And so after 8 years in the ICU, I definitely needed to transition into something else. I was probably the last person on my ICU unit to start taking medication for anxiety and depression. I mean, between the alarm fatigue and crisis mode and NIH scores every 15 minutes, it's just like a high stress scenario coupled with dealing with really heavy conversations. Also, because I really enjoy comforting people, they would often put me together with the patients who needed a lot more, not more emotional support, but like end of life or high anxiety patients, because I could calm them down. They said that's why they said I was like better than drugs, because I would emotionally connect with them. But that just gets heavy after a while.
I really love that story about your coworkers calling you better than drugs, because you could calm the families just by sitting with them and helping them feel understood. What do you
Well,
think?
not just the families either, right? Maybe a patient who didn't have any family. Like, there were definitely times when I spent the last half hour of my shift holding a patient's hand because they'd had all the anxiety and pain medicine they could have. And the only thing I could do for them was comfort them. So I'd chart with one hand, because we didn't have ambient charting. So I'd chart with one hand and hold the patient's hand with the other so they wouldn't be alone.
That's the power of personal touch, and every personal touch and therapeutic touch could go a long way for our patients. What do you think makes someone, like, if I'm the patient, that I will feel safe and truly heard by you?
Well, you are literally more the expert at this than me. I think all of the letters after your name mean that you're an expert in answering this question. So I might be feeling some imposter syndrome right now. But what makes somebody feel safe and heard? I mean, I think if you listen in a way that's not rushed, right? Let them finish, maybe restate what they were saying to make sure that you heard it right. And just validate that you heard it, right? Even if they're saying something and it's not even accurate, just letting them know that you heard what they meant to say makes them feel safer. And like they're not crazy in their head, like somebody gets it.
I agree with you. And the power of therapeutic communication for a patient, that they can be validated, seen, and heard are really important, especially when you're developing trust with them. You call that your therapeutic alliance. Now let me switch gear. You have a lot of experiences. You've experienced also burnout as a nurse. How do you know when you're simply tired or when you're emotionally running on empty?
One of the best descriptions that I did definitely experience is when you just start to feel numb. And so, whether or not you're still like highly reactive emotionally, when you start to feel like just not as moved by things, like I remember worrying that I was getting too callous about different things. And it's like you have to have some amount of detachment, but I think that was spilling over into my life outside of work, where I wasn't having appropriate internal emotional reactions to like normal life circumstances. And so I think, it's like getting too detached, maybe, because you felt so much emotion. And so you kind of like overreact in the opposite direction.
And my follow-up question for that is, what did burnout teach you about taking care of yourself while taking care of everyone else?
I learned that, well, one thing I learned from my patients being with them at the end of their lives, you have different ends of the spectrum, right? You've got those people who are like, I've had a good life. I'm ready to go. This is my time. I'm at peace. And they would verbally say that, and then there were times when people, have a lot of regrets. And so I think one of the things that I learned is, a lot of the times I would reflect, well, what if this was me? If I died right now, would I feel like I've, not just lived my best life, but am I content with how I lived? Is there something that's undone? And I didn't feel like that. I wanted to change how I take care of myself, and that I was not just working all the time and being exhausted all the time, but taking some time to really experience life. And so that when it is my time, I can say, I've lived a good life and I'm ready to go.
That's very important for our audience to follow, that sometimes we tend to overstretch our self and our emotions, and we're pouring everything for our patients, and sometimes nothing is left on us. So we need to make sure that we also balance things out, and also self-care is very important. Now, Rosa, I'm so impressed by you being an author. Your book is called Speak Up, Start Now. Why do you think so many people wait until they feel ready before they use their voice?
I don't know that they do. I don't know that they wait to feel ready. You are probably familiar with the Dunning-Kruger effect.
Mm-hmm.
Do you know what I'm talking about? Mm-hmm. How the less you know about something, the more you think you know. And then the more you learn about something, the less you feel like you know, right? So one person who is like one of the most hesitant people to speak on a subject, it has more than 26 letters after his name. And I'm like, I don't know who is more qualified than you to speak to this issue. But I think there's like just a comfort level with it, right? That comes through doing. You have to start in order to get through the cringe and through the awkwardness, and be okay with making mistakes in order to iterate and get better at communicating whatever it is. But there's so many wonderfully brilliant people who are so much smarter than me, who feel like either it isn't their place, or heaven for it, like they're waiting to be invited, Pedro. They're waiting to be invited. And who is going to invite them if they don't know what's in their head? Right? You got to put out what you have to say so that people can invite you.
I strongly agree with that, right? Nobody can ever put you on that seat or that table if you don't put yourself out there. So the initiative of getting out of your comfort zone, right? Talking to stakeholders or talking to nursing leaders, and that could open up opportunities.
Or the news. Talking to the news. You know, a lot of nurses think that, oh, it's doctors that should be interviewed for the news. Well, there's not enough of them. There's just not. And they're busy, the ones that are out there. If we're going to improve the health of our country and the world, then nurses, who are the expert communicators and nurse practitioners, right? Because you were nurses first, are the expert communicators and know what gets through to the patients. But we understand like the medical terminology. So a lot of the times we serve as translators for that health education. And so I think it's utterly imperative that nurses be involved in spreading health information that is valid because we are uniquely positioned to do it. Nursing is the most trusted profession, and therefore, who better to do it?
I strongly agree with you that we are really one of the people that the society is looking out for, and we need to make sure we stand our grounds in practicing ethically and professionally at all times. And accountability, like great power comes with great responsibility. Like
Right.
being a nurse, really, we set the standards and we continue to elevate our profession. Now, you talk about imposter syndrome in your book. Why can we know we're capable and still feel like we're not good enough?
I don't know. Maybe when you feel like you're not good enough, maybe you don't know you're capable, right? I think it's a really easy. I see a lot of us struggling with negative self-talk, and we would never say to our friend the things that we say to ourselves, right? Or some people might ruminate on negative things that have been said to them. I mean, I've definitely experienced that. So I think it's really important to intentionally ruminate on any positive feedback you get. Like anytime somebody would write me an encouraging note, if it was one of those e-cards, I'll print it out. And if it's on paper already, I keep them all in a box. So, well, the ones that I don't keep sitting in my windowsill. So that if I'm feeling discouraged or if I feel like, why am I doing this? I'm delusional. Why would I need to be doing any of this? I can look back at that and remember, okay, this is working. It matters. I'm not just delusional. Like this meant something to somebody. So it's not about me. It's about who we're going to help. Right.
Super important. And what would you say to someone who has an idea or a message but keeps thinking, who am I to say this?
Who's going to say it if you don't? Have you heard the saying, if it's to be, it's up to me?
Yes.
Or as the Lorax said, unless someone like you cares a whole awful lot, nothing's going to get better. It's not. You just can't assume that literally anybody else is going to do it. Nobody else's priority is going to be your priority necessarily. So find a space. Like I remember, I've always had a penchant for like public speaking. I like I said, singing, being on a stage. I'm comfortable with that. But as a neuro nurse, I didn't necessarily feel like I had anything to contribute to that conversation for a while because, that's a lot to learn. There's a lot of nuance. And I had a mentor tell me, one day I hope to see you speaking on the stage at some stroke conference. And I was like, what would I talk about? I don't have anything to say. I'm trying to learn and just not be a bad nurse. And so I remember going to my first AANN conference and just listening listening to everybody in the hallways, not just in the sessions. And I remember hearing them talking about, yeah, but what are we going to do about transitions of care? And I heard that multiple times. Like there's just questions. Nobody had an answer to this. And so through that, just identifying, okay, this is a gap, and my experience led to me making the connection of, oh, this can be an answer to fill that gap. So I think if you listen for the gaps and if you see a solution, you can't assume anybody else is going to think of that solution or that they'll have the gumption to share it if they do think of it.
Yeah, and the power of sharing your knowledge by either publication or speaking at conferences, those are our roles also to elevate our profession and making sure that everybody is aware of the evidence-based practice. Now,
And then share them on social media where more people will learn about it.
Yes, like you are a well-known med influencers. So that's basically part of our advocacy to promote knowledge all throughout the nation, but also be global.
Mm-hmm. That's right.
Now let's talk about mental health. Can speaking up actually be a form of self-care?
Yes, definitely. So, and there's different aspects to this. Can I share something with you that I saw on, I don't know if it's Instagram or TikTok, but I saw this video where they were talking about how filming yourself and seeing yourself changes your perception of yourself. It's like for instance, if you're using a bunch of filters to make yourself look better than you are and even change yourself to look unrealistic, that can cause mental health issues, right? But if you're filming your real self, it can build your confidence and build your comfort level with hearing yourself, and you can iterate from that, even if you don't post it and share it. If you're just, that practice is it builds confidence in people. It builds their self-image. So I highly encourage people to record themselves to just have an accurate idea of what you look like and what you sound like and maybe how you should do it better. I mean, I think lots of people practice their conversations in the mirror, right? Do you do that?
I do that. And whether it's asking for help or setting a boundary, saying I'm overwhelmed with work, or simply admitting that you're not okay, that's part of your self-care.
Yeah.
Because you're trying to be aware of your own feelings and you're validating that.
Yeah, exactly. And I don't know about you, but like I'm an auditory person and I do verbal processing. So talking things through helps me think them through. Some people do more with writing, or process things in different ways. But I definitely think that practicing public speaking improves your mental health because it improves your confidence. I found out that public speaking is the number one phobia in the world. Did you know that?
Now I've learned something from you.
Hey, I didn't know that. So that's kind of what Toastmasters is for people to practice public speaking. And it can be just so beneficial to just help you in your everyday life, whether or not you're ever going to do more than a one-on-one conversation. Just to build that confidence, that helps your self-esteem and your self-image and how you see yourself. And then if you are able to clearly communicate your ideas, or at least better in a way that you're satisfied with, then you can feel good about yourself.
This is such a great conversation, and your insights about phobia, about public speaking. A lot of audience out there, they don't put on their bucket list like to be a speaker of a big conference because they have either a fear or anxiety. So we could definitely offset that as you do it more. You get invited to talk to a larger crowd, and the more you get confidence and the more that you're delivering it more natural, and be able to offset that fear of speaking and managing that's really powerful. Like you have the sense of control that I can do it. If others can, why can't you?
Exactly. And, not everybody needs to be a public speaker, but I think communicating with other people is so important for us to feel a sense of connection with people. And when we have a loneliness epidemic that I'm sure you see plenty of every day in your practice. And I mean, even if it's just to improve our one-on-one interactions with other people, we need to practice having real conversations in constructive ways.
Yes, part of the 5 M's of improving mental health is meaningful connections or meaningful engagements. So we have your being mindful about your feelings, like focusing on the present, not overthinking about the past or the future. And then meaningful connections, like what we're doing right now. And also, another one is movement. So a lot of our patients really need to get up and moving to improve their serotonin and caffeine endorphins. Physical
Mhm.
activity. They have found that a sedentary lifestyle is predisposed for you to having like depression or anxiety. And
Exactly.
another letter M is like your mastery, finding a job, a hobby that you enjoy. Like the both of us, we're both doing podcast speaking and some healthcare stuff that we are attending. And then the next M could be Mediterranean diet. So a lot of our patients find benefits with mood stability by enforcing or incorporating Mediterranean diet. So the 5 M's, mental
I
health.
love that. That is beautiful. I think I need like a poster of that.
Yeah.
Do you have a poster with that on
I
it?
do. I can share it to you.
Yes. I need to put it
Yes.
on my wall. My
Now
mom
you
wants.
eventually move from bedside nursing into podcasting, speaking, and healthcare media. What did your patients and families teach you about the power of this?
So I started podcasting for fun and for my own mental health, exploring the local Louisville community. And then I was invited to create a podcast because of that for stroke survivors and their caregivers. And that has just been such a gift, right? So, from my experience with the conversations with patients, I was able to know what their frequently asked questions are and find out really niche answers and what experts had those answers, right? Like a general neurologist may not have all of the specialized knowledge of a headache neurologist, for example. So when it comes to, say, migraine and stroke, I had an episode where I interviewed the headache specialist about common migraine and stroke, like interactions, how to know when to call 911 versus this is migraine symptoms, which was a very frequent issue that was coming up. And, not everybody is able to get an appointment with a headache neurologist to get these questions answered. So now they're able to listen to it from the source anywhere there's internet and get answers to at least, the standard baseline questions around this. And then if they need more specific things, then they can seek that out. But then also, a lot of people may not know that such a specialist exists to find one near them. So, it showed me the power of technology to amplify our human gifts, whether that's our knowledge or whether it's them partaking in feeling are vibing with each other vicariously, right? Because that's a benefit that's been shown of podcasting is like they feel connected to the host. So like your listeners are probably getting some emotional satisfaction listening to their friend Pedro, who is tickling their ears with his voice all the time. And then feeling that sense of connection, and then they have that built trust with you, right? So, through the process, I have learned different ways podcasting is beneficial.
Yes, and it's like stepping out of your comfort zone too, and you're able to at least share your talent, share your knowledge on a global stage. And now healthcare is changing so quickly, and we have attended Vive in LA, and we're gonna attend Health in Las Vegas this November. With
Yeah.
AI, technology, and new innovations, how do we make sure that healthcare doesn't become more advanced but less human?
Well, I don't know. It can be pretty inhuman right now, can't it?
Hmm.
How humane is a fax machine? How humane is not having access to your own medical records from 10 different places, right?
Mhm.
So, there are ways we can use tools to make our lives better. And then when people don't prioritize the people and think the tools can just replace them instead of make their lives easier, maybe that might be a leadership problem. I think there are definitely ways it can be done. I don't know how you and I can make sure of it other than just running our mouths about it to everybody who will listen.
And we want to make sure that we have a big role of making it still human, right? The human nature, nursing as an art and a science, and making sure that we don't lose that because a lot of
Mhm.
patients deserve the best care that we have. So we
Yeah,
utilize technology, AI with our advantage, and we need to learn and how to apply them in order to deliver the best care for our patients. So if we're
exactly.
not learning AI, we may be left behind.
Exactly. And thankfully now there are ways that nurses can learn about AI. Like they've got college courses about it. They've got Stephen Ferrara's AI in nursing. They've got AI Med and ABAIM incorporating nurses into their training. So I'm really excited to see all the different opportunities that are being opened up to nurses.
I agree with you. Nurse educators and also stakeholders needs to really incorporate the power of AI in the nursing curriculum so that a lot of nurses are equipped with prior to starting their first job because AI is here to stay.
Hmm.
Now, what role do nurses have in making sure the human side of healthcare doesn't get lost?
Well, there is no healthcare without nurses. So they can try to have it without us. But without us, it's just tasks, right? It took Florence Nightingale to know that they needed to wash their hands and wash things in order to not kill people. And AI can pick up on some patterns. But I think there's only so much that AI will push back on, right? I'm not sure what the latest is on that because I know you can train your AI to push back a certain amount. But, it was so unpopular for people to be told that they were carrying death on their hands, right? It took a lot of like time and relational convincing in order to make changes happen. And so far, I guess that I know of that we've seen with AI, especially, it doesn't have that innate compassion in wanting you to get better, right? That's not its end goal. And so it's will more likely to make decisions to preserve itself than to preserve you, the patient. So I think I think we're pretty much irreplaceable. They can try, but I wouldn't recommend it. It sounds very unsafe.
Yes, yeah, we are here to stay, and we want to make sure that nurses are still the backbone of healthcare, right?
Mhm. And
Right.
intention is everything, Pedro. I'd love to hear any examples you might have of this, but one example of the difference intention makes is, a surgeon holds a knife and cuts into someone with the intention to help them, and someone else takes the same device, cuts into a person with the intention to harm them. And that can make a really big difference. I don't mean in like a woo woo way, but I think we just cannot overstate the importance of intention. What do you think about that?
Yeah, I think so. The power of intention is really important, and we always need to make sure that we're still um, doing the best that we can in order to im- um, imply those interventions and apply them in the bedside. So
And do you feel like your patients can feel the difference in your intention in your conversation? Like if your intention is to finish this up as soon as possible, they're going to open up to you a lot less than if they can feel that your intention is to help them.
yes, they can definitely feel that. So we're also human, right? We can feel and sense when the provider is not connecting well with us, or they're just doing their job just to do it. Versus if they're passionate about it, will definitely show how you talk to patients, how you take some time to welcome them in the conversation, and offering that role that it's a collaborative approach, the role of the provider, the role of the patient, and vice versa. So those are those comes with authenticity and intentions to care for the patients.
Yeah. I mean, there were definitely like, you could see that in the difference in, we had different doctors in the hospital, and there were some that if I was a patient, I would not want them to come in my room. They might have been the smartest people there, but I didn't trust them to want me to not die. And then there were other people who I trusted that they would do literally whatever it took to make sure I was okay, you know?
Yes, so it takes that time for authenticity, intentionality, and also your capability to create a therapeutic alliance with the patient. And that's very
Yes.
important. They need to trust you in order for you to comply with treatment regimen too. So if they don't trust you, where there's therapeutic rupture, then there's a fracture with your relationship. So it's harder to come up with a goal, and it's harder for you to reach that treatment plan that you're trying to imply with them.
Yeah, because a lot of them, they're not going to understand all the nuances of it. People retain like 10% of the new information, but they remember how you made them feel. And if they feel like, well, my doctor really wanted me to take this, or my nurse practitioner, Pedro, really wanted me to do this, and I don't want to disappoint him. So I'm going to take it, even though I don't remember why I'm supposed to do it.
So the power of taking time to educate your patients really should be there, and we need to make sure that they can verbalize or understand benefits, risks, alternatives, and what are their options are. And that's very important. Options should be presented to them at all times.
Definitely.
Now, I want to bring you back to where it all began. You were in college and you got pregnant with your son, watching your grandfather's life being saved and thinking, I want to help people like that. Looking at everything you know now, what would you tell that younger Rosa?
I don't know. Probably not a whole lot, because I wouldn't want to scare her off, honestly. Because I'm really glad that I went through all of that. But it was rough. Like nursing school, those 2 years were like the hardest years of my life. I guess, if I could tell younger Rosa anything, I guess hang on, you'll get through it.
And that's important, right? When you look at your older version of yourself to now, it seems like there's a full growth or a metamorphosis that you are able to fly now on your own. And looking back at Rosa, the evolution of older to the newer version of you, creating an impact right now is immensely appreciated by a lot of people around you.
Oh, I appreciate you too, Pedro.
Rosa, where can people follow you in your social media and everything that you're doing right now? And I know that we will both gonna be in health in Las Vegas. Where can people follow you in order to connect with you or ask you some things about neuroscience and stroke?
Well, for nursing and health related things, as well as my GLP-1 weight loss journey, I'm sharing all about that on at Nurse Rosa Speaks. That's on Instagram and all the others that use at. And of course on LinkedIn. Because we did talk about the other podcast I started with, I did start learning how to use social media as a foodie influencer, and I still do that. So when I go around and see great people like you at these conferences, anytime we like go out to eat or I get a chance to see the sights of a new city or something like that, as well as when I'm adventuring around Louisville, I love to showcase that. And that's actually a mindfulness process for me because it helps to ground me in this moment to make sure I'm appreciating what's right in front of me. And that is documented at Rosa Raves on Instagram and TikTok. So I do have the 2 separate accounts because there might be a lot of bourbon and cheese on the Rosa Raves account. And I didn't want to have confusing messages with my stroke awareness stuff. But you got to enjoy life in moderation, right?
Rosa, thank you so much. You're such an amazing person. Thank you for being here. Yeah. And sharing not only your professional journey, but also the personal lessons behind it. I think one of our biggest takeaways from our conversation is that finding your voice isn't always about being the loudest person in the room. Sometimes it's simply having the courage to say, this is what I have experienced, this is what I have learned, and this is what I believe could help someone else. And sometimes speaking up isn't just about changing the conversation around us. It can also be taking care of ourselves, asking for help, setting healthy boundaries, acknowledging when we are struggling, and giving ourselves permission to be heard. Rosa's book, guys, is Speak Up, Start Now. And I think that message goes far beyond healthcare. Because how many of us are waiting for the perfect moment? Waiting until we're more confident, more qualified, more prepared. Maybe we don't have to wait. Maybe we just have to start. Start your podcast if you're wanting to.
Yeah.
You're spending part of your day with us here on Mindful Moments. And if something from today's conversation resonated with you, share it with someone who might need to hear it too. Until next time, take a moment to pause, take care of yourself, and remember, your voice matters. I'm Pedro Imorante, and this is Mindful Moments. Take care of yourself and your mental health, and thank you for making your mental health a priority. Thank you, Miss Rosa, in the house.
Thank you, Pedro.
You're the best.
We did it.
Health in Las Vegas.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.